Hello doctors, as day before yesterday I have posted the pre-test questionnaires on the acute inflammation, and now I told you that I'll go with the answers, and I'll also post the PowerPoint associated with it. Friends, this is a very important topic. You must have observed in the questions also that this is the most important topic, where you will find there 4 to 5 questions, integrated questions from this topic in different streams. So this is a very important topic. That's why I take it on the upfront and posted the questions. So before going to the questions, if I'll go to the questions, then definitely we'll see that what there are acute inflammation presentation. You can find and download this presentation below in the link given. Features, you all know, rubor, tumor, calor, dolor and functiolasia. So microscopic changes, most important thing is when the permeability changes in the vessels or in the cell wall, the first thing comes in the mind is permeability changes for what? Inflammations. In inflammation, since body is giving some response, so there is a change of permeability for the protein, not for the water. So cells are moved out of the interstitiums. So this is this all thing you can see. Starling law, if you connect these questions to the physiology in the first MBBS, in cardiac output you are reading the Starling law. So this is connected to the pathology also, inflammations. So this is the normal graph, this is the inflammation graph, and this is the venous outflow graph. So you have to check what is the area in the graph between the hydrostatic pressure and colloid osmotic pressure, and then you have to judge whether it is a normal. It means it is a balanced one. If it is more area, then it's an inflammation, and if it is a less area, then it is the venous flow obstructions. So again, immigration, migrations, neutrophilic infiltrations. This is very important diagram. I purposely posted over here, so you may find this question in the November or January exam. The same question. This is from their question bank. Injury. This is what happened to when injury. This vasodilation, exudate, increased lymphatic drainage, cells. So what are the body response? What chemical releases? What is the delayed response? Which type of receptors are involved? So membrane receptor module. So that's very important. ATP to convert to CATP, and GTP to CGTP. So adenyl cyclase and glutenyl cyclase enzymes are involved. So they can ask the enzymes. They can show this diagram, and they can hide the name of the enzyme, and they can ask about the name of the enzyme. So this is very important diagram again. Then chemical mediators, proteases, prostaglandins, cytokinins, product from the platelets, product from the neutrophil, product from the endothelium, and then plasminogen activator inhibitors, oxygen derived free radicals, which causes the injuries. Then the phagocytes, the migration, histamine, where it produced. So then IL-1 and TNF activate E selections. All activities related to the endothelium, like histamine release or thrombin activation on P selector, E selectin, or ICAM or VCAM also upregulated on endothelium. So what happened on the neutrophil during the phagocytosis is this is LFA1 and VLA4 activation, system activation. So this is an exception. So that's why you have to remember this, very important. So what's happened in the this is depicted over here, and chemotaxis, what happened there. So you can go through this presentation, and I'll not take your time much. So this is hepatic abscess. So you have to identify the tissue. So if it's a brown color tissue and the shape of the tissue like a caudate lobe of the liver, so that's why it's hepatic. So that's related to the anatomy. So you have to remember the anatomical shape. Then what happened to the in pericarditis? This may ask, they may ask these questions. If I remember correctly, this was asked in the INI's first INI CT examination. This pericarditis picture was given, and they asked about the diagnosis. And nowadays, this is a very common finding after the post-COVID vaccination, because the most common side effect in the age group of 12 to 18 due to the live vaccine virus is the pericarditis, reporting of the pericarditis in this group, as well as in some young adults also. Number of pericarditis cases are increasing. That is due to the COVID vaccination. So if they ask any questions, so we will discuss that one during the questions also. That's the wound healing. That's very important. Wound healing important part is that's the schematic diagram to phase of the wound healing. So they may ask this graph, which I have given the question also. What happened? Granulation, angiogenesis, epithelializations, maturation. So for example, the question may ask here also that they may give that during the process of wound healing, if a person is on atrovos, what step of the wound healing will be affected? So definitely the angiogenesis will be affected, because atrovos property is it reduces the vascular formation. So it inhibits the neovascular formation. That's why angiogenesis is reduced in that case. So wound healing in if a patient is in atrovos will be some sort of delayed wound healing in those patients. So this is a basic concept. You must remember this thing: epithelialization, maturation, contractions, then moist wound healing, and what factors affecting the wound healing. And these practical considerations you must remember these practical considerations. Why? Because if a question asks, what mistake we commonly doing is, when any clinical questions comes, we always think of the advanced thing, but the basic is you always think of a basic. For example, when this is a golden principle in India, every case of the fever must be suspected as a malaria case. Up to when it was malaria was endemic in India. Now the endemicity is reduced in some states, so definition has changed, but this was the definition. So every case of the fever treated as a malaria until unless it proves otherwise. So that's the basic thing you must consider, until unless it is promptly in the question that some advanced findings were given, so you can go for the advanced things. And what test for the wound assessment, best test for the wound assessment is TCPO2 is the best test for the wound assessment. So this is the laboratory test for the wound assessment. So this is again it will affect the wound healing. Clinical appearance: sludge, yellowish, necrotic tissue black, infected tissue green, granulation tissue red, epithelializing tissue pink. So this is very important. If a diagram is given in which slough or yellowish tinge is there, then it's a sloughing wound. If it is a blackish tinge is there, then it's a necrotic wound. If it is a greenish hue is there, then it's an infective wound. If it is a red, then it's a granulating. It's a pink, then epithelializing. This is the given sloughy wound. So you can go through it. This slide, what is the treatment, how it can be managed, the dressing, necrotic wound dressing and management, infected wound dressing, management. This is important. Granulating wound. So epithelializing wound, and different kind of dressings. So dressing choice is important. So film dressings, this is an important question. They may give the diagram and they ask what is this. Then the hydrocolloids, pectin, gelatin, carboxylate, cellulase and esterase. So this is the for the sloughy wounds. So that's important choice. This is foam dressing. It's semi-permeable. So important is hydrogel. Again, it's a low exudate, shallow wounds. It's used hydrogels. 94% of the water in that. Dressing choice. Debridement methods, tissue viability. So all these things you must go through these slides, and definitely this will help you in the examination and attempting the questions. Now the question was, which of the following is not a feature of inflammation? So any such question, this is a basic thing. I will not discuss all the answers because the link is given in my video, but I'm giving you a hint or a help how to handle these type of questions in which the not is prominently given. So not is given means whatever history is given in there, you just go through the answers. So you will find there are two answers in which there is a conflicting things are there. For example, in this question there are C and D is the conflicting thing. Why? One is saying fluid leak, another is saying water permeability increase. So in case of pathology, the fluid is always considered. I am not saying water is not there, but in terms of pathological disease, we are taking exudate as a fluid, proteinaceous liquid as a fluid. So, and that's happen in the inflammation. So answer C and D are conflicting, and we know that pure water is not coming in the inflammation. What comes out is the proteinaceous exudate. So that's why the correct answer is D. So water is not. So this is just an example. This is not the intention that you will find the similar questions, but this is how you attend those questions. In this, you just see the two answers are not talking to each other, they are opposing each other. So answer is always lies between those two. So you can narrow down your choice from 25% to the 50%. So that's the best way to check the answer. So this we discuss Starling law and everything. So you go through this and you will find that answers and descriptions there. So what happens, what are there. So if you go through these answers, detailed answer, then definitely it will help you to understand the presentation effectively, and you will remember the infections, inflammation and wound healing. And I am sure that going through these two things, this presentation and this question detailed answer, will help you in the examination, and you won't remember, you won't forget the things, and you can answer on questions on these topics at 2 a.m. in the night itself. If somebody asks you in the sleep what is the answer of from this topic, you will give correct answer if you go through from these questions. So this is all about the inflammation and wound healing. So if any doubt remains, please post in your comment box or send me to the mail so that I can reply you whenever I get the time for that. And in the next coming week, I'll try to post 2 more videos of 2 different topics. It is not sure that it will be pathology, it may be microbiology, it may be pharmacology, or it may be some other subjects, but all the topics will be integrated and heavily weighted. What I told you, that I will post the videos in which you will find your maximum question. Maximum means 80% questions from those topics, and the questions which I will post is mostly from the question bank, and you understand what the question bank I am referring to. So so that's all to you, and good luck, and keep study for your next exams. Thank you very much.